Hi. So this scenario starts out with some really good points. I saw the nurse acknowledge the mother that she seemed to be doing a good job with her feedings. She had reviewed diaper changes and really just encouraged her at the very beginning with those certain things. She took the time to review the diaper changes and just was really encouraging during that part. She didn't have the mom really do a hands-on. She just kind of quickly showed her how to do a diaper change and reviewed the information very quickly. But at least did address those things and said, I see you're doing a good job with the feedings, and here's a review of the diaper change. So I thought that was a really good point in the discharge instructions. However, the number of negative points of her not caring in the discharge instruction video was far outweighed the good points. She basically just dismissed a lot of the concerns that the mom had of during the discharge and really just kind of brushed them under the rug and was trying to quickly do the discharge without really addressing the things that the mom wanted to talk about, whether they were important or not. Some of these things that the mom mentioned was the fact that she doesn't have a home to go to. She wasn't really empathetic towards that, and also didn't really address where the baby or the mom would be going, which was very concerning. She also didn't really address the fact that it seemed like the mom had a little bit of detachment from the baby when she asked just if the baby was cute. So that's definitely concerning with a new mom and something maybe with postpartum depression or just overall depression or just overwhelming that the nurse really didn't take the time to care and help the mom in that situation. She also just dismissed the fact that the patient asked for pain medicine with a known history of substance abuse. If you have a patient asking for that, especially going through childbirth, there should be some education associated with that and time to kind of care. Should I do a pain assessment? Is there a change in the pain? Just kind of reviewing all of those things to make sure that we're not missing anything. And also educating why Motrin is the appropriate choice in the discharge situation. How would I respond to this situation? I think I would recognize that this situation requires a lot more time than an average discharge. I think I would really try to get my other patients covered or my other responsibilities and really sit down with the mom who has a lot going on and try to work through some of these issues. Mostly to make sure that it's a safe and appropriate discharge, but also that that I'm helping my patient out because she clearly is in need of a lot more education than she was provided during her hospital stay. So I think that really taking the time to be there with the patient would be a lot better. I also think doing a hands-on demonstration with the diaper change, having the mom really help with that would be more beneficial. Teach back is always the best way of showing that the patient has learned something. So I think that would also be very beneficial to the patient. And like I said, again, I would also address the pain issue. I think that that's just something that's really important, and especially with young life like a baby involved, making sure that the patient isn't going to turn to other outlets and that Motrin is what she's going to be using and not pushing it off to 2 weeks with the doctor is very important. In this scenario, the priorities for the patient were really, you could see just accepting the huge change in the responsibility of having a baby. Also, pain medication, that was something that was important to her, that she brought it up to ask in the discharge instructions. So I think that that's definitely, a priority for the patient. And then for the nurse's priority, it just seemed she wanted to quickly discharge this patient. She was ignoring a lot of the red flags that were coming up and just kind of bagged everything up and said, all right, you're good to go without reviewing or providing any education to the patient. I think that some of the resources that she could have done were, more education, more hands-on information, reviewing everything with the patient, and then more, in-depth could have been a social work consult, addressing the lack of housing, possibly resources available to mothers with history of substance abuse or no housing, low income, different programs like that that are available to these moms. So I think getting those people on board earlier in the discharge process, or even, possibly even having to hold up a discharge process, would have been beneficial to the patient. And I think overall, just watching this video, it makes me really appreciate, taking time to reflect on my actions towards patients and making sure that I'm providing all of the education that I can, really listening to my patients, not brushing anything under the rug. If it's important to them and they're bringing it up, then I need to address it. So I think just really slowing down and taking the time to really give my patients all that they deserve in the discharge process, or even just education, is really important and something that I definitely took away from this. So that's it.